Hi there my friend, it's Sunki here. Take control and be happy every day. Today I would like to talk to you about buprenorphine. Now if you haven't already subscribed, make sure you hit the subscribe button and give it a thumbs up. Without further ado, let's rock it! I used to work in the largest buprenorphine dispensing pharmacy in Victoria, Australia, and I see buprenorphine helped many people getting back their lives. Many pregnant women also go on opioid maintenance therapy so that the doctors can monitor them closer and to ensure the safety delivery of their baby. One's messed up life is in order because of opioid maintenance therapy. So if you're struggling from heroin, opioid dependency or addiction and you want to live a normal life again, don't hesitate. Make an appointment to see a doctor today. That is the first step on getting your life in order again. Now, buprenorphine is the second most popular treatment prescribed by doctors for opioid maintenance therapy. It comes in a sublingual tablet form, which will melt in your mouth. The way to take it is to place it under your tongue until it dissolves completely within 2 to 10 minutes. The reason why you need it to be under your tongue and not to swallow it is because it gets absorbed through the blood vessels under your tongue. It is not a tablet to be swallowed. If you do swallow it, it will just get destroyed in your stomach and it will not get absorbed properly. So you'll be just wasting your money and time. And chances are the pharmacist will refuse to give you a second dose. So how does buprenorphine work? It works similar to methadone and it functions very similar to the opioid, the heroin itself. However, it has a slower effect, a slower onset, and it doesn't give you the high that you get from heroin, which means you won't slump back down into withdrawal and cravings as fast either. This gives you more control and your life back. Your doctor will work with you to slowly taper off buprenorphine to reach abstinence, which means you no longer need to rely on buprenorphine again, and that is the ultimate goal. And eventually you will be drug free, and there are many successful cases on this. Now it is possible that the first dose will cause some withdrawal symptoms, but they are usually not severe. The withdrawal symptoms may start within 1 to 4 hours and last for up to 12 hours, and after that you should be fine. Like methadone, make sure you do not take any opioids, alcohol or any benzodiazepines during this period of treatment, as this will increase the risk of overdosing and it can affect the assessment of your symptoms, and it can take longer for the doctor to be able to tailor a correct dose for you. Buprenorphine can cause drowsiness, especially when you are just starting the treatment or if the dose is increased. So please do not drive or operate any machineries if you are affected. If you do visit any other doctor or dentist while you're being treated with buprenorphine, make sure you let the doctor and dentist know that you are on buprenorphine so they can prescribe future medication appropriately. Now, while you're going through the opioid maintenance therapy, your doctor will be able to direct you to the right counselors and services to help you regain your life back as well. During this time, you will have more control over your mind. You can set your heart down to reconsider and make decisions in regards of your life. What you want to do in your life, people whom you want to cut off from your life that are not good influences, and people whom you want to improve your relationships with, such as your family members. You can also consider returning to study, upgrading your skills so you can get better employment, or you want to start looking for employment right away. Now, having things to do daily where you have progress in your life is one of the source to mental stability and happiness in life. Now, there are tons of motivational YouTube videos out there that you could go for to improve how you think and ultimately improve your life. A few motivational speakers that has changed my life that I recommend are Tony Robbins, Brian Tracy, and Zig Ziglar. So make sure you check them out. They are very good in helping people get their life in order and ultimately create a better future for themselves. I myself has also put together a series of videos in talking about happiness and bad thinking habits that we need to crush, we need to get rid of to be able to live more fulfilling lives. And I'll put the links down below for you. Now, all the best in getting rid of opioid dependency. I have seen many successful cases in my life practicing as a pharmacist. It is very positive and very encouraging. So the first step now is to make an appointment to see your doctor and go from there. Pick up the phone and start dialing. Okay? If you haven't already subscribed, hit the subscribe button and the bell as well. Give it a thumbs up. I will really appreciate that. And now comment down below if you have used buprenorphine and you have any buprenorphine experiences, so you encourage one another. If you want to know about methadone, I've also got a video talking about methadone. I'll put a link down below for you as well. Let me know if you have any other questions or if you want me to cover any other drugs or medications. I will be delighted to do that for you. It's Sunkia. Take control and be happy every day. With lots of love. See you next time.